Welcome students, I'm Serena Luchensky and I'm one of the co-directors on the Master of Public Health programme. I'm really excited to welcome you to the MPH, welcome to you to the virtual UCL online learning environment, and I'm really excited to meet you all during Welcome Week, which is coming up right away. I thought I would just record a short video to give you an overview of the program, talk a little bit about the vision, about the learning approach to the program, and bring you up to speed with where we're going to go on this exciting MPH journey over the next year or longer for those who are part-time. So what I'm going to cover in this presentation is a little bit about the vision of the program, the values and ethos that are underpinning it, what the program journey looks like. So what are the modules? How do they fit together? What's our approach to teaching and learning on this program? A little bit about the assessments, not too much detail there. A bit about etiquette on online learning. What are the kind of expectations for our program? And then tell you a little bit about who the teaching team are, and finally some useful contacts. You'll get a second introductory video from my co-director Denish, who will go through a lot more of the practical aspects to the introduction, but this is really just to give you a flavour for where we're going. So let's talk about the vision for this program. Firstly, we wanted to make sure that it was comprehensive, that you are going to walk away from this program as well-rounded public health professionals, and you can signal to employers that you have all of the knowledge and skills and expertise that you need to be really fantastic at your new roles. So we've mapped our curriculum against two internationally recognised curricula. So firstly is the UK Faculty of Public Health, and secondly the World Health Organization ASFA curriculum, which is based for public health professionals across Europe. And so this is making sure that we've covered all of those core areas across public health. Secondly, we're going to be delivering high quality teaching from lots of different disciplines, not just population health. This is one of the strengths of UCL, is a multi-faculty university, so we can draw on expertise from anthropology or geography or the built environment to really understand complex problems. Related to that is a focus on the big picture and systems thinking. So really thinking about public health issues within the wider global context in which they occur, so that we can understand how things interact and how we address different issues from a sort of multi-sectoral perspective. And then underpinning the program are these 6 unique careers-focused core themes, which have been interwoven throughout the entire program in every single module. So the first of these is interdisciplinarity, which I've just mentioned. The second is health inequalities, which is really bread and butter. Public health is really understanding disparities, inequities. How do we measure them? How do we tackle them? How do we address them? And UCL's got a fantastic track record in research in this area. The third is around citizen voice. So this is really quite unique, I think, that we will be bringing in the perspectives of the public to understand problems from their perspectives, but also how do we work collaboratively with citizens, with communities to develop effective solutions. We'll also be working with and involving practitioners and policymakers and advocates within our teaching, so that you get some really great experience and knowledge working with these different people from different organizations and really understand what it's like on the cold face. The fifth one is around core skills. So not just our hard skills around epidemiology and statistics, which will be really underpinning everything that you do on the program, but also skills around leadership, around communication, about working with other communities, and how to be inclusive, and lots of different things like this. And I'll talk a bit more about assessments later, but our assessments are really about helping you to build and develop these core skills as well. And then finally, the sixth theme is around implementation, action, and impact. And this is absolutely core. So it's not just about understanding the theory and practice of public health, but actually, how are you going to go out and really make a difference to the health of populations in your communities, in your home countries, when you finish this program? So let's talk a little bit now about the values and the ethos of this program. We're a new program, and I think it's quite difficult to say what we're about in this space. I made a little word cloud using our some of the documentation that we've written describing the program, and came up with keywords around social justice, around it being interactive, and building community and being inclusive. You can have a look at all these little words here that I've come up with. But I think really it's about us as a group, as a cohort, to define these values and this ethos together. I think one of the key strengths of this program is the fact that we have so many different people from different countries around the world working, collaborating, learning together. And that is going to create a really, truly unique community and learning experience, which I think will develop our own sense of ethos and community. So yeah, I think it's something that I look forward to developing and working with you all, alongside all of the fantastic lecturers and program team that we've got, to define what we're all about this year. As a new program, it's quite an exciting opportunity. So now, just to walk you through a little bit about what your MPH learning journey will be. Obviously, if you're part-time or flexible, this will look different depending on your situation, but it gives you a sort of flavor of the journey that you're going on. So in term 1, this is the foundation of your program, and fundamentals of interdisciplinary public health, applied epidemiology, and statistics for public health are taught in this term. Most students, whether they're part-time or not, will start with the fundamentals of interdisciplinary public health. In term 2, which is from January until March, this is the expansion phase of your program. These modules are all core as well, and it doesn't matter so much if you're part-time in what order you do them, with the caveat will depend on which optional modules you choose in term 3. So term 3 is where it gets a little bit more complicated in terms of the part-time students. If you're full-time, you'll just choose any of these, choose 2 of any of the 4 modules here. Applied quantitative methods for public health is a more in-depth quantitative methods course, and you need to have taken applied epidemiology and statistics before taking this module. Applied infectious disease epidemiology is, again, a more in-depth look at infectious diseases. We'll be touching upon them in health protection, but obviously this is a sort of more advanced module, and so you'll need to have completed the health protection module as well as the applied epidemiology module prior to taking applied infectious disease. Qualitative mixed and participatory research methods doesn't have any prerequisites. We will touch upon these methods a little bit in fundamentals, but if you do want to gain these skills, this is the module to choose. And then urban health, which doesn't have any prerequisites, so that's open to anybody to take that in term 3. And then finally, you'll have your dissertation, which is the integration of all of the knowledge and skills which you've gained across the program. It looks like it's at the end here, but you begin thinking about this right from term 1 and thinking about the topic that you want to do for your independent project. I won't tell you more about the modules yet. Each of the module leaders has done a video to tell you much more detail about the content of each of these modules. So I'll leave it to them to tell you all about it. So now let's think about the online teaching and learning approach on the MPH. So there's 2 types of activities that you'll be doing on this program. The first are called asynchronous, and that means that you do them in your own time. There's lots of different things that you'll be doing. You'll be reading, you'll be watching videos, you'll be completing these multimedia learning packages. So, you might have some videos, you might need to do some matching exercises or little quizzes or different things, and you'll get familiar with all of it in your own time. All of this will be available on Moodle, and it's up to you to pace yourself and decide how you want to approach these materials. Then we have what's called synchronous learning materials, and these are essentially the live online Zoom sessions which we have every week for each module. So each module will have an option of a morning or afternoon session, and you will attend one of these sessions and participate with your classmates and with your lecturers in more discussion-based and collaborative type learning activities. Now, our program uses what's called, in sort of technical terms, a flipped classroom approach. And that means if our classroom is our live Zoom session, you need to complete all of the asynchronous materials prior to attending that Zoom session. So we will set you a whole bunch of activities within Moodle with all these readings and videos and all these kinds of things, and you will need to do all of these things prior to attending the Zoom session. And so that enables us to make sure that everyone is coming with some knowledge about the topic that we're discussing, so that they've read and understood and reflected as much as possible before coming to the session. You've brought your questions with you because you've been thinking about the material, you've been engaging with it, and that enables us to have a much richer discussion and to work much more collaboratively together if we're all on the same page. All of the asynchronous materials are going to be released 2 weeks in advance of the weekly live Zoom session. So that will give you 2 weeks to get through all of the material and to get all ready to attend the live session. So just to briefly touch upon assessments, firstly, just introduce you to the terminology. So we talk about summative assessments, which are the things that you get marked for, usually at the end of the module. And then there will be a number of formative assessments that help you build up to that summative assessment. So these might be things like quizzes or practice questions, which you assess yourself on, or different tutorials or activities that you do throughout the module. And it's really important to engage with these formative assessments as you go through the module so that you can perform your best at the summative assessment. The other thing that I'd just like to say about the assessments is that the approach that we've taken across the program is to try to make things emulate the types of skills that you need to develop to be able to be an effective public health professional when you finish the program. So we might have you performing presentations to mock panels of senior stakeholders, or to create a media briefing, or to write a policy document, for example. And all of these different things will help you to develop those skills throughout your program. So now let's just talk about some expectations for our etiquette around online learning. I hate to give rules around these types of things, but I think it's useful to discuss right from the outset what we're kind of expecting, because that will help set the tone for what we're going to be doing on the MPH. you may have never done online learning before, or you may have done it elsewhere, and there's different rules and different ways of doing these things in different places. So firstly, be on time. We will be starting the live Zoom sessions exactly on time. We're not going to wait 2-3 minutes for people to keep joining. Join early so that we can start straight on time. Come prepared. So as I said about the asynchronous material, it's going to impede learning of others. If you're in groups, for example, you haven't done the reading, you haven't watched the videos, and you're trying to work collaboratively and you're not prepared for the session, and that's going to let your classmates down, and ultimately it's going to hinder your learning. Please turn on your camera. It's the only way that we can engage with you and get to know you. This is like, turning up in person to a classroom if you were doing face-to-face learning and not just relying on your friend to give you notes. Of course, there's situations where you might need to turn your camera off if someone comes into the room, or you've had a delivery or something's happened. But as a general principle, we'd love to see you and really would like to encourage you to keep your cameras on. Number 4, ask questions. There's no such thing as a stupid question. We want to hear if you're struggling with the material, if you have had some different thoughts about things or learned things in a different way before and want to query. Just ask us. That's what we're here for, and would love to hear all of your questions. Please keep your microphone muted when you're not speaking. So if there's background noise where you are, that enables everyone to be able to hear. Be respectful and be mindful of your language. We're all coming from different places, different cultures, different communities. If you don't know the right term for something, please just ask. But the principle is to be mindful, to be respectful, to be kind and considerate of all of your classmates and teachers on the program. Don't get distracted. So, the Zoom sessions are really important. Make sure that you've got a quiet, private space that you can attend your Zoom sessions and you're not going to be disturbed. Please don't share any inappropriate or confidential material in the chat. So, if you've got your friends' email addresses and you think, oh, well, we'll just send those all out so we can all get in touch. Somebody might not want that to be shared. So please don't share any of confidential or personal information like that, which could be upsetting for somebody, and make sure that we're doing this in appropriate private channels. This last one, number 10, is a bit of a tricky one. Don't dominate the conversation or the discussion. Equally, don't not speak either. It's really tricky sometimes, I think, getting a balance for how much we should be talking, how much we should be listening, and what our level of participation is. And in different cultures and in different communities, people have different styles of learning. So, some cultures expect the lecturer to ask them, to call on them to ask a question, for example. We don't do that in this program. I'll just be open and honest. We expect you to come forward, to raise your hand, to participate, and to engage. And that might be a bit uncomfortable for some people to start with. But if we're not dominating, for those who are comfortable, we're encouraging, we're respectful, we're kind, we're considerate. And then I think we can really work together to really try to build a community of learners together on this program. And I think that's really fundamental and really key for all of us to have a really good learning experience. I mean, you can talk more about this and, in terms of, any etiquette or anything with your individual module leaders. But I just wanted to say something about it at the start so that, we can all be on the same page and thinking about how we're going to support each other to work together collaboratively and learn together on the program. Right, nearly there. Sorry, this is a little bit small, so you might need to pause it and zoom in. I just wanted to give you an overview of who the teaching team are on the MPH. So there are two co-directors, myself and Dennis Steffler. And then we have a whole team of people supporting you on the MPH. So we've got a student advisor, so that's Rebecca Eaton, and she's there for all of your well-being needs. So that first point of contact, if you're struggling in any way, if you've got any personal issues or extenuating circumstances for an assignment, Rebecca is there to really support you. We've got a few different administrators who are your educational support staff. So another Rebecca and Rahima, who are the main MPH administrators. And then we've also got Rachel, who is from Health of the Public, who's a coordinator to help organize seminars and different things like that with us. As we're an online program, we've got learning technologists to help us with all of the tech issues which we might have. So we've got Richard, who's our MPH dedicated learning technologist, but also Sean will be helping out, and he's the faculty learning technologist for population health sciences. And then we've got 4 core lecturers for the MPH. So we've got Emma Beard, Masuma Mishu, Aradna Koshal, and Aisha Ayman. And these 4 lovely lecturers are, I think they're on every single module. There is at least one of them helping. So or co-leading, I should say. So you will get to know these 4 lecturers really, really well, and they're fantastic and great resource for any issues you might have on the program. And then there are loads of other UCL lecturers, too many to list here, who will be contributing to the program, and you will meet as and when on your individual modules. Some of them are co-leading some of the modules, and some of them are just giving guest lectures. But there's a huge array of really fantastic people across the university who are contributing to the program. So in terms of key contacts, any questions that you have about the specific materials and contents, the best protocol is the module leaders for those modules to understand any of the issues that you're having there. If you have any administrative issues, difficulties with registration or anything like that, Rahima or Rebecca will respond to you, and we've got a generic email address for the administrative team, and they will get back to you right away from there. Any tech issues, like I said, we've got Richard, and he can help you, but also, some of the module leads can help you, or the administrative staff can even help you too with Moodle and things like that. For any personal or well-being or any other kind of issues, Rebecca Eaton is there as your student advisor to help support you, and I think she'll be introducing herself on Moodle, and you'll be able to see what types of support she is offering. And then, as I said, there's myself and Dennis, and we're the co-directors, and we're very happy to hear from any of you at any time if you've got any complaints or any issues or suggestions. We'd love to hear from you. So that's it for me for now. Dennis has got another introductory video which is going to get into more of the nitty-gritty practical business that I'm sure you all want to know about. So I'll say goodbye for now, but a massively warm welcome to the program. I'm really excited to meeting all of you at Welcome Week and getting stuck in on the MPH. So we'll see you soon. Thanks.